My name is Dr. Jeffrey Elder. I am a gynecologic oncologist. So where I'm from is a small town in South Georgia called Americus, Georgia. Not many people have heard of it. It's famous for Jimmy Carter is from Plains, which is in the same county. Habitat for Humanity actually started there, so that's kind of my hometown's claim to fame. My background is varied. I was a swimmer at University of Tennessee. Actually graduated from college in my hometown from a little small school called Georgia Southwestern. So it's kind of similar to North Greenville here in the upstate. Medical school, went to Mercer University in Macon, Georgia. I did my OB/GYN residency in Birmingham, Alabama at UAB, and then a 3-year GYN Oncology fellowship at University of Kentucky. One of my interests is holistic care, and so gynecology is a specialty that offers not only primary care and clinical care in an office setting, but also surgery. And so we're able to treat and reach patients as gynecologists and as GYN cancer surgeons across multiple venues in terms of where people come to get their care. What interests me in my job and what makes me continue to come to work every day is the relationships that I'm able to develop with patients and their families. As a cancer specialist, we're involved with patients with the highest of highs and the lowest of lows, and we get to know patients through these difficult times sometimes, and we get to know their families. That's one of the things that drew me to this specialty was that human connection that is missing a lot of times. One of my unique areas of interest within my specialty is research. So clinical trial research is a big part of what we do at the Prisma Health Cancer Institute. And I've been the lead investigator on several national trials that we've had open here, so several dozen at this point. And so that's a unique offering that we can give patients. We can give patients a world-class experience that they might only expect to find at a regional or national referral center, and we can give them that experience close to home here in South Carolina. So my style of practice is very personal. Like I mentioned earlier in one of the other questions, I really like to get to know my patients and get to know their interests. I want to know what makes them tick, what are their goals, and I try to integrate that into every part of their care and every discussion that we have. We'll revisit those things at different points along their continuum of care because ultimately, I'm in the business of treating people and not just a disease. Prisma Health offers several unique advantages. For one thing, when I first came here, there was a distinct need for this specialty. Gynecologic oncology is a relatively rare offering, and when I first joined the health system here, there was a need. We needed additional providers practicing this. That's what drew me to this area initially. The reason I stay at Prisma Health is because of the integrated nature of our healthcare system that we have here. We're able to offer patients not just surgery and not just chemotherapy and not just the specialized care in the office, but we have a robust clinical trial research infrastructure. We have all of the other supportive services that we need to provide comprehensive cancer care, from physical therapy and integrative medicine, all of the other surgical subspecialties with interventional radiology. And it just allows me as a practitioner to provide the full complement of services for my patients. A couple things that most people don't know about me. I was in undergrad, I was a minor league baseball mascot for a period of time. So that was a unique job. I was also an All-American swimmer in college. Currently, my big interest, aside from spending time with my family, enjoy the outdoors, which is a big draw here in the upstate. And I do endurance athletics, so long-distance swimming and running. I would say the advice that I give patients most frequently is to not stop. When you deal in the world of oncology, as I do, it's a fight, and it's sometimes it can feel like an uphill battle, but it's not always uphill. There are times when people can coast and people can relax and enjoy life, and I really want to integrate that into a patient's experience. There are times when we need to be full court press, and there are times when we can relax and stop and smell the roses, and that is what's most important, I think, and sometimes lacking in cancer care is we get too focused on the fight and we forget about the human component to make sure that we're balancing not just quantity of life, but also quality of life. If you'd like to make an appointment with me, I'd love to meet you. You can do so by calling the number on this webpage or by contacting your primary care provider.